Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today we're going to talk about eczema, otherwise known as atopic dermatitis. Those are two terms for the same thing. Eczema or atopic dermatitis is a chronic rash of the skin that is more common in children but can happen at any age. I've seen patients develop it in their 70s for the first time. It is more common in families that have asthma, allergies like hay fever, and keratosis pilaris, which is that bumpy upper arm rash, since those conditions are all genetically related. However, eczema can also just happen all by itself. Eczema is typically reddish or pinkish, although it can be many different colors. It can be the same color as the regular skin. Sometimes it becomes a little bit lighter or a little bit darker from the chronic inflammation. It is usually rough and flaky, and it is very often extremely itchy. The most common locations are the backs of the knees, the inner arms, the neck, but it can commonly happen also on the face and the eyelids and really anywhere on the body. We do not really know all of the reasons that people develop eczema. Some of it is genetic, some of it is an immune system issue, and some of it really is unknown. I do find that a lot of patients get a lot of misinformation about it online, and by the time they get to me, they've done a lot of things at home that make it worse, and by the time I see them, they are literally miserable and suffering tremendously. People often underestimate the difficulty of having a bad skin rash, and eczema can really disrupt your sleep. It can make people embarrassed. They are always scratching at themselves. They sometimes get depressed just from their suffering from the rash itself. So it's really important to get a proper diagnosis and treatment and not to suffer with a lot of misinformation from the internet. So the first thing that you need to do if you have a bad rash of some sort is to get to a board-certified dermatologist as fast as you can. This can be difficult as there's a shortage of dermatologists in many areas of the country and the world. And in the absence of being able to see a dermatologist, if you think you have eczema or another kind of skin rash, you would want to see a primary care physician, pediatrician, somebody who can hopefully start treatment and make a referral if needed. When I see a patient with eczema, often the diagnosis is very obvious, but sometimes, especially for someone with a long-standing rash and no proper diagnosis, we need to do a biopsy. So sometimes when you see a dermatologist, a skin biopsy will be performed. It's usually very simple. We just sort of clean and numb a small area of the skin that's being affected by the rash. And we shave a little tiny piece off, and we send it to the lab to find out what it is so the pathologist can take a look and give us a reading and a diagnosis. There are a lot of rashes that can look like eczema. Sometimes it's not that easy to diagnose, so sometimes it's important to know for sure. Sometimes we don't need the biopsy, but sometimes we do. And once we know for sure that the rash is eczema, either with a biopsy or just by clinical examination, we can dive right into treatment so the patient can feel better as soon as possible. So let's get into treatment. It's really fairly straightforward. The most important thing about treating eczema is moisturizer. When somebody's skin is raw and irritated, ointment may be necessary because if you put a cream or a lotion on, it will burn. And ointment is something that is clear, it's Vaseline-based typically, and that is much more soothing and will help repair the skin barrier faster and allow healing to begin and also help prevent new spots from appearing. People sometimes don't like putting on ointments because they are greasy, but that is usually what's going to work the best for this. So ointment is definitely indicated. Those are usually Vaseline, Aquaphor, Vani-Ply ointment, or something of that variety. If the skin can tolerate a cream and the patient prefers a cream, then that's fine. Any brand will do. I like CeraVe, Cetaphil, Vani Cream, really anything. There are some patients who also prefer natural therapy. I would say coconut oil is a good one for this. And moisturizer needs to be done at least twice a day, once right after the shower and then one other time. So typically it would be morning and night. Vaseline or ointment-based can be greasy, so sometimes I'll recommend that at night and a cream in the morning if that works better for the patient's lifestyle. But moisturizer is mandatory. Number 2, after number 1 being moisturizer, number 2 is to stop scrubbing. I find most patients, for some reason, have been scrubbing this rash in the shower. Maybe they feel that it is due to some type of dirt or infection, but it is not, and scrubbing it in the shower makes it worse. A lot of times people are using a loofah or a buff puff or a washcloth and literally taking soap or body wash and scrubbing the rash. So that all has to 100% stop. I usually recommend short showers, no baths. Sitting in soapy water and soaking is not going to make this better. It's going to make it worse. Scalding hot, long showers are also going to make it worse. So I know it's hard to take a cold shower. I don't necessarily recommend that, but I'd say stay away from scalding hot water. Try not to be in the water for all that long and only use soap where you need it. So hands, feet, face, under the arms, groin, but do not scrub the rash for the most part unless you're actually dirty and rolling around in the mud. Soap, even mild soap, does strip away the natural oil out of the skin and breaks down the skin barrier, and the rash just gets worse and worse and worse. So no scrubbing. Just to repeat, number 1 is moisturizer. Number 2 is stop scrubbing. Number 3, take oral antihistamines to help reduce the itch if you can tolerate oral antihistamines. So these pills have their own whole set of side effects. Common ones are dry mouth, dry eyes, and drowsiness. So patients have to be careful with them, but they are very good for reducing the itching. They are all available over the counter. The brand names are things like Benadryl, which is short-acting and fairly sedating, so best to be used at night, as well as Allegra, Zyrtec, Claritin, and Zizal, all of which are theoretically non-sedating, although different patients have different reactions to different medications. And I would recommend those during the day typically, and a Benadryl at night. And I tell people not to wait until the itch is really bad. Just take them consistently for a couple of weeks while you're waiting to get better and calm everything down. So oral antihistamines can be very helpful if the patient can tolerate them. Number 4 are topical prescription creams, and these come in a few different classes and varieties these days, but the mainstay for quick relief are still topical steroids. There is an over-the-counter version of 1% hydrocortisone. Again, I prefer the ointment to the cream, but both will work. But the over-the-counter version really is very weak, and if someone has real true eczema, it will not be enough, and they will need prescription steroid creams or ointments. These are not good for long-term use because they can thin the skin, they can bleach the skin, and they can cause stretch marks. But with proper short-term use, they can be incredibly helpful and useful. There are also calcineurin inhibitors such as tacrolimus and related medications, as well as other newer creams, which attempt to change the body's immune system at the site that you're putting the cream on, so it reduces the inflammation of the eczema and makes the rash go away more quickly. There are new creams coming out for this, honestly, all the time, and I expect even better new ones in the near future. So after we have stopped scrubbing, moisturized like crazy, done some oral antihistamines, and tried some creams, oftentimes that really fixes everything for the patients. They just needed a little bit of education and reorientation in terms of their skincare. But sometimes the eczema is really severe and those usual treatments are not enough. So I'd like to discuss 2 other options. Number 5 in our classification of different options would be light treatments. And light treatments are done in a dermatologist's office. They can be very useful for treating severe eczema. More specifically, they are called ultraviolet B phototherapy. And you can ask your dermatologist if this is right for you. It does require many treatments and maintenance, but it is safe and effective, and it generally gets very good relief from this condition. If it does work well, it is possible to either buy your own light box and use it at home or petition your insurance company to get you your own light box to use at home. This is not a tanning booth. Please do not go to a tanning booth. This is light treatments done under the supervision of a board-certified dermatologist. And then last but not least is systemic therapy. There are many different systemic therapies for people with severe eczema that have been used for many years. The newest one, the brand name is Dupixent. It is life-changing for people with severe eczema. However, these all have their own set of side effects because they do suppress the immune system to some degree. So this is something to discuss with your dermatologist and your doctor to see if those treatments are right for you. So, in summary, eczema is very common. It can be all over the body. It can affect anyone at any age, but it's more common in kids. It requires a lot of moisturizer, less or no soap, and often prescription creams, oral antihistamines, and if the patient is not getting better, more aggressive treatment. If you think you or a family member or friend has eczema or any other type of rash, get to a board-certified dermatologist. There are many other rashes that can look like eczema. It's really important to get a proper diagnosis so an effective treatment can be started. And people really suffer from these rashes, so don't delay your treatment. Get seen by a doctor as soon as you can. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.